Okay, we are live on YouTube. So I'm Jonah Axam, as most of you guys probably know. You can introduce yourself.
What'd you say? I can hear you.
I think you can introduce yourself to the people so they know who you are.
What's up? My name is Daniel. I'm Republicanpatriot. I'm from TikTok. You can follow me.
Okay, so we're going to hop straight into this. So the first topic that we'll be discussing today is Trump's coronavirus response. So I'm going to read my opening statement. It's a very long opening statement. And then I'll get a response either in an opening statement or just however you want to do it. So, okay. Here's my opening statement. SARS-CoV-2, also known as COVID-19, also known as coronavirus, has ravaged the populations and economies of countries across the globe. After originating at a Chinese seafood market in November, the coronavirus spread throughout the world, eventually becoming a pandemic. While some countries have had effective responses, the United States has been utterly incompetent. Let's start with the facts. Despite making up only 4% of the world's population, the United States comprises over 1/3 of all confirmed coronavirus cases, surpassing even Italy in cases per capita. We've tested 17% fewer people per capita than the European Union. Countries that have tested more individuals per capita than us include Spain, Russia, Germany, Canada, Switzerland, Portugal, Ireland, Singapore, Qatar, the UAE, Austria, Israel, Denmark, the Czech Republic, Kuwait, Bahrain, Luxembourg, Estonia, New Zealand, Slovenia, Lithuania, Latvia, Cyprus, and dozens more. We should be able to agree that some of these nations are well equipped to administer more tests than us, but many of these countries should never be outperforming America, given the fact that we are the wealthiest and most prosperous nation in the history of the world. Despite the WHO testing kits being widely available and effective since January 18th, the United States declined to use them even before the CDC had functional test kits. Political rights, quote unquote, start quote, manufacturing problems, possible lab contamination, and logistical delays, end quote, prevented the United States from meeting early demand for testing. For a month straight now, the United States has had over 20,000 new cases a day, and it does not appear to be falling. It is very clear that we have done little to no effective damage control, and that we are being hit harder than many other countries. There's a common narrative on the right that we could not have expected this coronavirus, but the exact opposite is true. The United States is one of the greatest intelligence agencies in the history of the world, and we identified the coronavirus in November, according to a report by ABC News. Israeli intelligence confirms this, explaining that the United States became aware of an emerging disease in Wuhan in the second week of November, yet they chose not to act. The first confirmed case popped up in the United States on January 30th, one day before the travel ban from China. However, the Trump White House has received at least a dozen reports on coronavirus throughout December and January. This classified information was likely ignored, considering Donald Trump has repeatedly denounced the intelligence agencies of the United States and has confirmed that he does not read his daily briefings. One intelligence official states that during late December and early January, reports about coronavirus were appearing in Trump's daily briefings as frequently as large-scale terrorist threats would. Furthermore, a public report published by the Beijing Emergency Medicine Research Institute reported that the earliest reports of coronavirus happened on December 8th. Even if this overwhelming evidence was not enough for any reasonable person to conclude that we were well aware of the imminent threat of coronavirus, a publicly published report from Science China confirmed human-to-human transmission was possible on January 20th. 10 days before coronavirus reached the United States. Wuhan officials immediately announced they would be locking down the city of 11 million and banning all travel by January 21st. There is this common idea that the WHO is an independently operating body, but in reality, the only administrative action taken by the WHO is carried out by the member states. Although they provided false information about human-to-human transmission, this information all originated from China and there was no independent verification. Any competent president would understand that China is an irresponsible actor and that it was necessary to look deeper into this, as there is no reason to lock down a city of 11 million if human-to-human transmission is impossible. And because we have the strongest intelligence community in the world, a lack of knowledge about the threat of coronavirus before the end of January indicates a shocking level of stupidity and ineptness. Despite the fact that it is abundantly clear that we know about the threat of coronavirus in mid to late January, had we not known about it, it could be largely attributable to Trump as well. In 2018, Trump dismantled a National Security Council directorate that was charged with identifying and responding to pandemics. The former director of the team described the role of the team as a smoke alarm to help detect pandemics in their early stages and limit their spread. When asked why he disbanded the team, Trump said, quote unquote, "This is something that you can never really think is going to happen." Furthermore, on November 5th of 2019, we cut the PREDICT program, an international intelligence program that does, quote unquote, research vital to preventing pandemics, according to The Hill. In 2019, the government released a report called Crimson Contagion that said during a pandemic with low mortality rates, 110 million Americans would become infected. The Trump White House pushed this report down and made sure it never came into the public eye. Another report published by the Council of Economic Advisors shows that the free market does not have viable incentives to create a vaccine, yet Donald Trump did not establish a public program to research and respond to the threat of a pandemic. Johns Hopkins ran a simulation in November showing that a SARS outbreak would decimate the United States because we have relatively no pandemic detection infrastructure or response capabilities. This behavior from Donald Trump is part of a long pattern of neglecting responsibilities and ignoring intelligence. The United States has many faults in our actual response. Trump took essentially zero administrative action in February, despite having access to knowledge about the severity of the disease. His travel ban for Chinese citizens was okay, but he ignored 100,000 people that traveled from China in January after we had already discovered that human-to-human transmission was occurring. When we repatriated 40,000 Americans during the month of February, we did almost no testing or quarantining. We just allowed them back into the country. Now it is being confirmed that deaths in mid-February are due to the coronavirus. We did not institute strict social distancing guidelines or test people coming into the country during February. The United States sold millions of masks, ventilators, and pieces of personal protective equipment to China. On April 20th, at least 11 to 36% of all healthcare facilities in the United States reporting having a shortage of personal protective equipment. If Trump had utilized the Defense Protection Act, we would never have had these shortages as a result of the greed of corporations. Furthermore, Trump repeatedly denied the severity of the coronavirus, saying that cases would drop to zero and that it was fine to attend rallies and have large gatherings in public places. However, a report by The Hill shows that if Trump had taken measures to institute social distancing 2 weeks earlier, 90% of United States coronavirus deaths could have been prevented. If you want to look at other countries that have actually handled this well, look at Vietnam, South Korea, Germany, Israel, and even Thailand. These countries do not have better intelligence or more developed economies than us, but they utilized their resources and kept their country safe. Thailand had the first non-Chinese coronavirus case, but despite administering over 225,000 tests, they only have 3,000 confirmed cases. They almost immediately evacuated Thai nationals from China, tested every single one of them, and quarantined the ones that they were unsure about. On January 23rd, as soon as China went on lockdown, Thailand banned all non-essential travel to and from Thailand. South Korea has administered 660,000 tests, yet they only have 12,000 cases. They almost immediately established large-scale drive-through testing and encouraged likely infected individuals to self-quarantine. They used a smartphone app to communicate with citizens about spikes in their area, immediately shut down schools, and started contact tracing almost immediately. Israel, on the other hand, utilized their amazing intelligence from Mossad to discern and obtain the personal protective equipment necessary. They administered 450,000 tests and have only about 16,000 confirmed cases. They immediately restricted travel and imposed social distancing in March. Although there are countries with worse responses, the United States is shockingly underprepared in terms of securing medical equipment, limiting the spread of coronavirus, and securing our borders. I think it is an indisputable fact that Trump has not handled coronavirus to the best of the ability of a president of the United States of America.
That was long. I didn't know it was going to be that long.
Yeah, it's very long. I think it's comprehensive though. I don't think it's repetitive. There's a lot of delineation in the story.
No, yeah, it was really good. I really don't have, but I'm just I have a bunch of stuff. So I have a timeline. So when do you think Trump should have took action? What event would have happened?
I think that genuinely the best response that we could have taken is I have no issue with the ban of Chinese nationals on January 31st. What he should have done is all repatriating American citizens, all 40,000 of them that came back to the United States, should have been immediately tested for symptoms and quarantined, as well as utilizing the Defense Production Act so that we're not producing these masks, these ventilators, these personal protective equipment, and selling them overseas, and then we have a shortage of them during the month of April, during the month of May, during the month of March. That's what we should have done. If you want to talk about the economic side of it, I can too. But basically, the Trump did not take this threat seriously. He encouraged his supporters to go to rallies. He didn't take any social distancing measures. He didn't set up infrastructure to get people to report coronavirus cases. He used a faulty test when we had a viable one that was developed by Germany, and that's part of the reason Germany has such low coronavirus cases, because their testing is so good. He didn't set up contact tracing immediately. There's a multitude of things that Donald Trump could have done. And I'm not saying this is an easy situation to handle, but I am saying that a more competent president would have handled it more competently.
Okay. So I put together a little timeline of all the events that happened from when this started. So I'm just going to read it out loud. So January 6th, Wuhan travel issue is advised. January 11th, the CDC tweets about a pneumonia outbreak in China. January 14, WHO tweets that there is no evidence from human to human transmission. January 17th, health screenings start at 3 U.S. airports: San Francisco, JFK, and Los Angeles. 121, the first case is found in the United States from someone that traveled from Wuhan. 123, World Health Organization says again that there is no evidence from human to human transmission. January 27th, World Health Organization raises alert of the pneumonia outbreak, but says that China has it contained. January 28th, CD states in a tweet, while CDC considers COVID a serious situation and take preparedness measures, the immediate risk in the United States is very, very low. On January 29th, the day after that is put out, that it is the low risk in the United States, the White House establishes the coronavirus task force. 2 days after that, the travel ban from China. I can't even see. February 7th, the first White House task briefing happens. January 9th, he meets with governors regarding the virus. February 12th.
Wait, okay, sorry. I think you said January 9th.
No,
okay, yeah,
February. February 9th, he meets with the governors. February 12th, we have the first death in the United States. February 24th, he asked Congress for $25 billion for the virus effort. February 27th, his first community transmission in the U.S., and then as they grew a few days later, he called for a national emergency. So I mean, there are stuff that he, like what you said, there is stuff he could have done, but
so much stuff.
Yes, but like he also didn't do nothing.
Yeah, I didn't say he did nothing. I said that his response was incompetent, and he had information that was prevalent, or not prevalent, that was extremely relevant.
Up to the January 25th, you had the World Health Organization saying that there's no human-to-human transmission.
And we knew that that was not the case because we have the best intelligence community in the entire world, and China had already issued a statement within Wuhan. That information that the WHO repeated was issued from China because China were trying to protect themselves. Now, a competent president would have looked into that and said, we know for a fact that that is not true because we are seeing human-to-human transmission, and the city larger than New York City is being locked down. The entire thing, travel's being banned. People aren't allowed to go outside. So there is clear evidence that there's human-to-human transmission. Now, I'm not saying that who was responsible or that China was responsible. They're not. We should have foreseen that. This is our fault. This is 100% Donald Trump's fault for not foreseeing that those two organizations are irresponsible. We know China's an irresponsible actor. They covered up the SARS outbreak in 2002. We know that they're not going to do the right thing, so we should be acting on our information rather than their information.
Mm-hmm. Well, he did defund who?
Okay, that's completely irrelevant to the fact that he had all the information that he needed. And if he didn't, it's because he shut down 2 pandemic intelligence agencies because he said we would never need them.
Yeah, that's true. I do disagree with that. That was not the best move.
Okay, so we agree that despite the fact that I'm not saying Donald Trump did nothing. I'm just saying there are way more effective measures that he could have taken that he did not take, which is why I am going to be extremely critical, because this is not an issue like tax policy where I think the economy does worse and that makes me sad. This is an issue where we are throwing away American lives because we are prioritizing our reputation over them, which is, I think, categorically wrong. And I think that Donald Trump has a long history of that. I can get into that if you would like me to do so. But at least in this specific case, I think that there should be a bipartisan recognition that Donald Trump did not do as well as he could have done.
Yeah, I mean, I'm trying to think what to say. Yeah. So what do you think about making people stay in lockdown? How do you feel about that?
What do you mean making people stay in lockdown? You mean like forcing social distancing and making sure that people can't go outside? I think it should be. I mean, this is because I'm very libertarian. I'm a social libertarian. Not a socialist libertarian. Don't mix that up. I'm a social libertarian, and I think that personal freedom shouldn't be infringed. But I think in the case of a pandemic where you can demonstrably measure the amount of lives lost as a direct result of people not social distancing, I think that it's very clear that within the constitutional parameters set out by our forefathers that the United States government has the right to infringe upon your freedom to gather until there is no demonstrable, because even like the most far right libertarians will say, as long as you are not causing physical harm to another individual, you have the freedom to do whatever you want. But if we can prove, and we can, that lack of social distancing causes physical harm to other individuals, then we should be able to say that it's okay to ban people from gathering. I think that that's pretty non-controversial as well. I would like to see, I mean, Sweden is doing something very, very interesting where they're doing very little lockdown at all, but they're doing contact tracing. So if you have the coronavirus, they'll talk to everyone that you talk to, test all of those people, and then the rest of the people can just go out and do something. I think that's an interesting idea. I don't think it would work in the United States because we don't have those capabilities. We don't have such a strong social safety net that the government can easily mobilize and track every citizen in the country. And I also think just like the sheer size of the United States makes that a lot more difficult as well. But I think that that's also an interesting idea. I would like to see our economy reopen as fast as possible. Is there anything else that you have to say on the topic, or do you want to move on to Medicare for All?
We can move on to Medicare for All.
All right. You can start off on this one.
So I believe that, like as we were talking before, I believe lack of healthcare in the United States is a problem. But I haven't seen a good proposition from any congressman or president yet that would really help the problem. But I believe that we really need to focus on, instead of an overall scheme of healthcare in the United States for every single person, I believe that we should start programs focusing on the people who don't have healthcare, why they don't have healthcare, and how we can fix that. I don't know, like if we had like socialized healthcare in the United States where everyone gets healthcare and we all pay for each other's healthcare. I don't know, because like in certain countries that have socialized healthcare, the quality isn't as good as we have here. But then there's also people that don't get the healthcare here. So there's pros and cons to it. But I believe that.
So can I real quick ask what ranking system you're referencing when you say countries with socialized healthcare?
Because I've looked at multiple ranking systems and they have all different countries. Like some have the UK is the number one, and some have Canada, and some have. I don't know which. I don't know which one to believe. I mean, you're going to rank the systems based on different things, like medical emergencies. You have surgeries.
Okay, well. There's lots of different ranking systems. Have you ever seen one that has the United States at number one in terms of anything? Obviously, I know Alex is watching this right now, and
I'm not saying that we have the best healthcare system in the world. I'm just saying I don't think universal. I just don't think universal.
There's a demonstrable impact. There are many countries that spend a significantly lower percent of their GDP on healthcare that have better healthcare than us by almost any metric that you use. Whether you use a conservative metric, whether you use a leftist metric, whether you use a pro-business liberal metric, there's no scenario in which healthcare correlates negatively with socialization. I think that that's just a myth that's made up by the right. But if you look at actual proposals for Medicare for All and you really look deep into them, they would drastically improve the amount of people that are being covered, as well as reduce the costs, the cost of healthcare for the average American. I can send you multiple studies on this. There's one from UMass Amherst, like their economics department. There's one from Emory University. There's one from Yale University that's a bit sketchy.
Reduce the cost of healthcare, but wouldn't it just come back in taxes?
No, so here's the thing. Here's the thing.
Healthcare, you would just be paying more taxes.
You would be paying less. So, like, let's say your healthcare is $10,000 right now.
You're paying less for healthcare, but you'd be paying more in taxes. So it kind of evens out.
And you have more money in your pocket. The average American would have more money in his or her or their pocket.
For someone else's healthcare.
Well, you're paying for someone else's healthcare right now. In this system, you're just participating in a large network. Do you know how an insurance network works?
Yeah.
So like let's say like I pay $1,000 a year, right? And I utilize the healthcare 0 times in that year. But I know that if I were to have a heart attack, if I were to get into a car accident, I'd have cheap healthcare, right? So that's how an insurance network works. So the idea of a Medicare for All system is just one of those insurance networks that encompasses everyone in the United States. So right now you're just paying taxes, and then poor people, poor working people mostly, get and old people get Medicare and Medicaid, which is actually you paying for someone else's healthcare. Right now, you're paying for the VA to operate, which is you paying for veterans to get healthcare. Under a single payer system, you're all just part of the insurance plan, so you're just paying for your own healthcare with a risk sharing pool. It's a much more effective system, at least in my opinion, than whatever system we have now and whatever alternative has been proposed. I don't like know any. I mean, obviously there are issues with it, as there is with any type of healthcare system. Obviously, there are not dysfunctional public healthcare systems as a result of the fact that every other developed nation in the world has a public healthcare system. And if there is an issue with any developed nation in the world, people are going to come back and blame it on public healthcare. But at the end of the day, that would be the most effective way to get healthcare to the majority of or not the majority of uninsured Americans, and at the same time reduce the cost for the working class.
Mm-hmm. So, do you think that this would lower the quality of healthcare?
Not at all.
Not at all. Okay.
I think you look at you look at a nation like Australia or Germany or Sweden or Denmark or Norway or even Canada. Even though Canada has huge issues with their healthcare system, and I can talk about those too, but all of those have higher quality of care than we do. Australia pays their specialists more than we do, and if you look at the example in the United States, the first expansion of Medicare, which is healthcare for old people, free healthcare for old people who are majority retired. Yeah, I'm just explaining for everyone in the chat. You saw utilization rates didn't increase at all. So people weren't using the hospitals more. It was just people that were less healthy were using the hospitals, and they were turning away rich people that could pay that weren't actually unhealthy. Public health didn't decrease at all. You just saw people that actually needed healthcare getting healthcare, because you have rationing in whatever system that you have. But right now, the United States rations on cost and sometimes race, rather than actual need for healthcare. And I think a much more effective system would be rationing based on actual need for healthcare. And then if you have enough money, you can just on the side pay for private healthcare, which you can get whenever you want. I think that's absolutely the fairest system.
Mm-hmm. You're more for like a choice more than just forced?
Yeah, it's not forced at all. You pay your premium and then whatever healthcare you want under the plan, which is basically all essential care. You can choose your doctor, you can choose your medication, you can choose your procedures. You don't have to get anything. It's not like the NHS, ideally. You can choose all this stuff. Ideally, like that's the way that it functions, and I think that that's the best system. I think that that's pretty conclusively true, but even if it's not, the Republican alternative is like unequivocally worse than what we have right now. It's just like an elimination of protections of pre-existing conditions and just like unfettered competition, but it doesn't work because healthcare prices are inelastic.
I haven't liked any healthcare solutions by Democrats or Republicans yet, but so I'm on the fence about this. I'm not really like,
Yeah, and it seems if you want to talk about this more, we can. But it's pretty clear to me that Medicare for all is the best way to go in terms of the plans that we have right now. And if I see, I don't even mind the idea, and I don't think Yang's UBI is good. But I don't even mind the idea of a UBI that's supposed to fund healthcare, or a tax credit that's supposed to fund healthcare. And then if you overspend it, you have to pick up your own bill. Like, I don't mind the idea of that. But I think that we have a couple leftist politicians advocating for a system that covers all Americans, and 0 Republican politicians advocating for a system that covers all Americans. And I would rather go, even if it weren't a better, more cost-effective plan, I would still rather go for the proposition that covers all Americans, and it is a better and more cost-effective plan. So that's yeah. I don't know if you want to talk about anything else, we can.
Well, yeah, because we went those pretty quick. I don't know, whatever topic you want.
How do you feel about immigration?
So, immigration, I think that we should make it easier to get into the country. I think that's number one, because it's very hard to get.
Yeah.
I think it's very hard to get into the country. I think that we should really focus on. I mean, on the fact of deportation. I mean, I know we deport like just a regular legal family, but I think we should focus more on people who here illegally and commit crimes. I think we need to face before we even get to the subject of like regular families. I think we need to focus more on illegals who commit crimes here than any other. Yeah,
100%. I can 100% get behind that, because human trafficking is an awful practice, and it's supported.
And sorry. So I really believe that after that, if we can find a way to get those people out, maybe we can have a reform where they can find their way to citizenship, but then but then if we find a way to citizenship, we make it easier to come to the U.S. And then I think that we should I think it would work because we'd have stronger borders if people come legally, if they have no criminal records or anything like that, or whatever requirements you need to get into a country. I mean, that's really what I believe. I mean, I don't think it's I mean, I know that people come here because their countries are failing and stuff like that, but like I also see it as a way like I still don't think you should be able to break the law, but I don't think that if you really I really think that, like what I said, we should focus on getting the people out who commit the crimes and who do harm to the country first before the others.
Yeah, so you're very anti-Trump in terms of your immigration policy then.
Well, yeah,
anti-Obama, anti-Trump, but especially because Donald Trump. I mean, you said you think it should be easier to get into the country, but Trump has cut the amount of refugees that are allowed into the country. He hasn't done anything to expand the H-1B visa program, and he hasn't expanded the quotas for people that can come into the country just to migrate into the country because they want to. Which is, I mean, it sounds like you're very anti-Trump in terms of his immigration policy.
In a way, yeah, I'm on the fence.
Yeah, and I think that most reasonable people on the left and most reasonable people on the right who have any understanding of economics can agree that open borders would be a disaster.
Yeah,
because I mean that would just undercut. The EU is like a unique case, but that would just undercut. That would just undercut our labor market completely. But I think that there's nothing wrong with Customs and Border Patrol. There's nothing wrong with making sure people can't get into the country. But once they're here and they're already contributing to American society, I think that a path to citizenship is good. Even like a proposal, like a indentured servitude proposal. Like if you're caught here illegally, you work for no wages, just for food and housing and water for X amount of years, and then you become a citizen. I think that that's a phenomenal plan to help one, create industry in America, two, generate tax revenue in America, and three, allow people a humanitarian way to stay in the country. But I don't again, this is something that I've not seen any Republican ever propose anything that is a humanitarian way of making sure that people that are undocumented get to stay in the country and live their lives in an ethical way, especially when they have children. Because I mean, the family separations thing is awful. The zero tolerance policy, I think that everyone can agree on that. Even Donald Trump, who instituted the policy, agrees on that, but it hasn't stopped. And then that's just a disgusting practice. There's no reason that I would ever be able to conceive that we would target a working family who's contributing to the American economy and taking nothing in entitlements. We would take them, put them in a detention center, separate them, and never reunite them. That just doesn't make sense to me.
Mm-hmm.
Yeah. So, yeah, I don't know. I don't really have anything else to say. I'm about to go get some Popeyes if that's cool with you, unless you want to talk about something else. But it seems it's cool that we have come to the conclusion that Donald Trump has at least handled the coronavirus somewhat incompetently, and that Donald Trump's immigration policy is ultimately failed, and that's why we have the job shortage too. He's limiting the amount of people that can come into the country. Not the job shortage, the labor shortage. We have a job surplus, but wages aren't going up because we don't have any accountability for corporations right now. But anyway, it was good talking to you. If you ever want to do this again, or just talk one-on-one, you can always hit me up. I'm always willing to talk. And have a good night. Be safe. I'll talk to you later. Bye.